Hi, my name is Ashley Strang. I'm an instructor here at Keyin College teaching the dental assisting program, and I invite you to join our conversation.
Well, I'm Alan Dale from Gale Force Winds. It's an absolute pleasure to be here at Keyin College today, talking to folks that are finding a better way to educate and really transforming lives along the way. I like meeting these folks one by one. So on that note, why don't you introduce yourself and tell us what you do here?
My name is Ashley Strang, and I am the dental assisting instructor here at the college.
Talk to me about the program here at Keyin for dental assisting.
Yeah, so the program is a hybrid program. So we do some theory online as well as clinical practice rotations. So the students come into the school for 7-week blocks and do a clinic with us, hands-on learning, as well as 2 work terms.
Wow. Talk to me about that hands-on learning. What happens here at the college when they do that?
Yeah, so we do a clinic, level 1 clinic and a level 2 clinic. During level 1 clinic, it's more kind of getting the basis to perform different clinical duties on people.
Okay.
So in level 1, they're working on Dexter, we call him. It's just the mannequin. So they're, getting set up to do those real life skills.
Right.
Then they'll go on a work term, come back for level 2 clinic, and they'll see patients in the clinic. Yeah.
Oh, wow.
Yeah.
So patients come in, is that a service you provide to the community?
Yeah, absolutely it is. So
Oh, wow.
a very small fee, they come in. We have a dentist on staff as well. So they'll they'll get a pro fee, like a polish on their teeth. They'll get x-rays taken. The dentist will do an exam for them. They could be eligible for sealants. So we do all kinds of services. Yeah.
Well, that's incredible. I want to talk a little bit about the practicum part. Talk to me about the importance of that being baked into the program.
Yeah. So the practicum, in my opinion, is really important just because, when they're in clinic, they're with their instructors, they're with their classmates. It's really comfortable. Getting out into the community and doing those work terms, I feel just really ties in, okay, I want to do this for a living. It's easy to imagine what it would be like, but being able to be out in that clinic, working with strangers, seeing the public, seeing a plethora of different situations really gives you a big picture of what your career could look like.
On the plethora of different situations, where do people primarily go to work? Is it sort of a pretty broad or
Yeah,
talk to me about
it's
that.
all over. So our students are from here in Newfoundland, Labrador. We have one student right now actually in Fort McMurray. So
Okay.
she actually gets up, for my 8:30 class, Newfoundland time,
Yeah.
middle of the night, and comes to school. So for work terms, we can send them all over the province, wherever they prefer to go. So of course, if they are living home with mom and dad, they want to stay close to home, we can accommodate that. So
Wow.
all over.
Flexible, for sure.
Very, yep.
And when they go to work, it's not just in a clinical setting. What are some of the job opportunities for them?
Yeah, so I mean, primarily it is a clinical setting where most of our students go. I've heard of students getting jobs with insurance companies as well. Of course, instructing. I was a student at Keyin College and did the dental assisting program,
Okay.
and now I teach. So there are other opportunities. Sales reps, dental sales, that's another opportunity as well.
I'm glad you said that you were a student. So you're a graduate from Keyin.
I
I want
am.
you to tell me about your experience going through the program. What was that like for you?
Yeah, I had a wonderful experience. I actually teach with 2 of my instructors now, so that's a full circle moment for me.
Wow.
But yeah, I found Keyin to be really, really special, and I felt my learning experience was really unique, and I was really taken care of and supported. You just got that really small family feel almost. You could go to your instructors when you were feeling a little overwhelmed. It was just a bit different from other learning experiences that I've had.
A little unfair, this next question, because of course you now work with these folks. But when you think back on your journey as a student and those instructors, the importance of them having experience in the field, not just being able to give you the theory of this stuff,
Yeah.
but knowing that they've actually done this stuff.
Mhm.
How important was that for you?
Very important. And I think that's something my students love the most is when I tell stories about my experience in the field and, tell them about the different situations I've been in and the different things that could come up. And they love it. They eat it up. I think they
Right.
really love hearing those stories. And I think for me, knowing that my instructors were in the position that I was going to be in really helped because I knew what they were kind of telling me and guiding me was extremely valuable.
Right. So back to your role now as an instructor, and you've got students in the program, as you said, really across the
Hmm.
country. Is there lots of job opportunities for them when they come out?
There is, yep.
Yeah.
There are a lot of job opportunities. I am still, of course, a part of the associations and whatnot, and I get emails all the time. I would say every single morning I have an email from the, we call her the Newfoundland Tooth Fairy is the name of her company, and she recruits, for different offices, and every day, I'm not kidding, there's a new job opportunity. Yeah,
That's a
it's,
lot.
that's,
That's a big statement, right? Like
it is,
every single
and
day.
now I mean it's probably not a new
Yeah.
job every day,
Yeah.
but these positions are often left open. I think a little bit of it is people perhaps getting a taste of dental and going back and doing hygiene or dental school. That happens. But people moving, people going on maternity leave, not coming back, different things.
Yeah.
But there's definitely a need for it. There's offices popping up all the time all over the province, new grads coming out, opening up clinics. Yep.
And what does that ideal student look like from your perspective?
From my perspective, just really motivated and driven. Something I always tell my students is, they'll often say, oh my gosh, I didn't do extremely well in high school. And I just want to say to those students, this is this learning experience is different, and you may not have been top of your class doing math or biology, but we're there to support you. And an ideal student for me is somebody who is not necessarily getting hundreds, 98 every single test. It's someone who's showing up, first of all, motivated, asking the questions, being present, and just giving it their all.
Wow. Thanks very much for the
Yeah,
conversation.
no problem.